We will now begin our assessment of the thorax and lungs. To begin, inspect the patient's thoracic cage. Note the patient's shape and configuration. Count their respirations. Note any abnormalities or increased breathing difficulty in their respirations. Also assess the patient's skin color. Note for any abnormalities in the skin color and the skin's condition. Note for any overly exposed areas to the sun, any changes or any lesions that are present. Notice if there is any cyanotic areas or any areas of pallor present. Also examine the patient's position. Are they in a relaxed and comfortable position, or do they seem stressed or anxious? Note the patient's facial expression. Is it calm? Is it cooperative? And also note their level of consciousness. Are they alert and are they oriented? Assess the shape and configuration of the front, the skin's color and condition. Also examine the patient's posterior. The shape and configuration, the skin color and the skin's condition, any pallor or cyanosis. Next, move on to palpation. Beginning with the front, confirm that the patient has symmetric expansion of their thoracic cage. Next, assess for any tactile fremitus. Ask the patient to repeat the phrase 99 as you move the ball of your hand over the front of their chest.
99, 99, 99, 99, 99, 99.
Next, palpate the front of the chest. Palpate the entire portion of the anterior part of the chest. Note any masses, lumps, or lesions present. Also note for any tenderness that the patient experiences as you palpate the chest. Continue this examination with the posterior aspect of the patient's chest. Palpate for equal chest expansion and symmetric. Breathe in and out. Assess for tactile fremitus.
99, 99, 99, 99, 99, 99, 99, 99, 99.
And palpate the posterior aspect of the chest for any lumps, lesions, masses, or any tenderness that the patient experiences during the palpation process. Okay, you can turn around. Next, percuss the chest. Note for any resonant or dull sounds. And continue on the posterior portion of the patient's chest. Next, estimate the patient's diaphragmatic excursions. Ask the patient to exhale and hold it. Exhale and hold. Continue with the opposite side. Exhale and hold. Then ask the patient to inhale and hold. You can breathe. And on the opposite side, inhale and hold. It should be equal on both sides. Next, begin the auscultation portion of the assessment. Assess for normal and abnormal breath sounds. Just breathe normally in and out. Next, perform auscultation on the anterior portion of the chest. In and out, okay? Next, perform test of auscultation by performing the bronchophony test. What you want to do is you're just going to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Next, perform the echophony test. Just say E and hold it up.
E.
Just keep holding it. Keep saying. Keep saying. And lastly, perform the whisper pectoriloquy test. Just whisper 1, 2, 3. Just kind of whisper it. As you perform your assessment of the lungs by performing the auscultation methods, notice any adventitious breath sounds. Note for any rhonchi, wheezing, rales, or any other adventitious sounds that you may hear. This concludes the assessment of the thorax and lungs.